İçeri mi geçiyor? Bak deneyeyim mi?
İçerine sandalyemiz full ama.
Hello everyone. Let us wait a couple of minutes to everyone join today. Welcome to our YouTube live session. This is dietitian Duygu from Clinic Hub, and this is our lovely doctor, Dr. Ozan, and Dr. Burak. We will inform you about post-bariatric operations today, but I just want to introduce myself first. This is bariatric dietitian Duygu, and we do provide 2-year dietitian support to all of our patients. When they come here, we also provide some supplements such as multivitamin, protein powder, collagen to avoid having saggy skin or any other problems. But it's definitely up to the patient's genetic or patient's history. That's why it still might happen. That's why we also have some plastic surgeons to prevent these things. So maybe they can also inform better. Let me this microphone to you.
Hello, I am Dr. Ozan, and now today we will talk about the post-bariatric after gastric sleeve surgeries. And
Hello, this is Dr. Burak as my lovely friends here mentioned, we are going to talk about the post-bariatric surgeries, what you should be expecting from the surgery, how you prepare yourself, and what we can do for you. Before starting that, I want to personally say something. My son is watching right now, and he is waiting for me to say him good night to sleep. So, good night, Kemal. So here we are. Let's start.
By the way, you can also comment below and ask all of your questions. Maybe on the last 10 minutes we can get your questions and get answer from the surgeons. But we have some questions already. That's why maybe we can continue with that.
Okay. So we already received some questions about gastric sleeve surgery and this experience. I'm going to ask these questions to Dr. Ozan. Okay, so the first question is, how long should I wait after my gastric sleeve surgery before considering a mummy makeover surgery?
it is generally recommended to wait at least 12-18 months after their gastric sleeve surgery before considering a mummy makeover. This allows their body to stabilize after significant weight loss and ensure we see that they are healthy and we can do easily their operation, the elective surgeries, of course.
Can I add something too? After the surgery, you might reach your goal weight maybe after 9 months or after one year. So when you reach your goal weight, just inform your dietitian so we can send a weight maintenance program to you to maintain your diet and maintain the weight that you have. And if you are okay to have a surgery, our surgeons will make the surgery for you.
Okay, so I want to add something to these comments. After your gastric sleeve surgery, you will get into a period and you are going to lose weight intensely for at least 1 year. And what is important for us is that your body shape must be stable for several months before considering a surgery. And during that period, your skin will retract. And at one point, you will stop retracting and you will stop losing weight. So that's the perfect time for us to plan your surgical strategy, and this is the best time for us to provide the best possible result for you. So now this is the second question for Dr. Ozan. Can a tummy tuck address excess skin and stretch marks on the abdomen?
Yeah. Of course, the tummy tuck is effective at removing the excess skin and reducing the stretch marks, but on below the belly button, the middle and the lower abdomen, that place the stretch mark. But if the stretch marks beyond to another place, for example, the above the belly button, maybe after tummy tuck operation, their appearance will be bigger and wider maybe.
Okay, so again, to sum things up and to make things more, to clarify things, during the tummy tuck surgery, we basically remove the skin between the genital area, the hair-bearing skin, and the belly button. So all the stretch marks within those borders will be gone after the surgery. However, we will stretch the upper tummy skin down to your genital area. So automatically, the stretch mark located on your upper abdomen will stretch down, and these stretch marks might be more visible. However, if depending on your skin thickness and your skin quality, your stretch marks might go directly down. So all stretch marks might stay below your belly button. So the third question, Dr. Hasan Ozan. Will I experience pain and discomfort after a tummy tuck, and how long is the recovery period?
Yeah, of course, pain and discomfort are common in tummy tuck operation because also it's a big surgery, they have stitches, we also repair the muscle, it is painful. But after operation, we give strong painkillers, of course, and they stay at hospital 2 nights. Then when they discharge from the hospital, also we'll give the painkiller. It is typically in a few weeks for doing activities. And then day by day, they will be better, of course. And 2 months later, everything will be better, of course, except swelling, of course. Swelling is different, 6 months, sometimes 1 year.
Can I add something else? So when you come here, we will be glad to see you. Please just let your dietitian know so we can come and visit you at the hospital or at the hotel, or if you want to come to our clinic, we will be so pleased. So just let us know. We can also do like dietitian consultation face to face here. Also, when you go to hotel, you will have some post-op doctors and the nurses, so you're not gonna be alone. Like 7/24, Clinic Up will provide all the services for you.
Again, to add some more information, all doctors who are working with Clinic Up, we perform our surgeries in A+ hospitals and fully established hospitals. And for pain, actually we are following the same protocol, and which includes narcotic painkillers and regular painkillers. And you are going to go get this treatment properly and according to medical text lines. So there is nothing to worry. Of course, this is not a pain-free procedure, but all the pain you are going to experience is manageable pain, and pain is not our enemy. Actually, manageable pain is something we prefer, because the fluctuations in that manageable pain will tell us something is wrong. So we can intervene and prevent all possible complications. So manageable pain is our friend here, and there's the thing. Now I'm going to the fourth question for Dr. Hasan Ozan. Can a tummy tuck improve my abdominal muscle tone?
Yes, of course, we always repair the abdominal muscle, especially if the patient weight loss or pregnancy, the abdominal muscle separated. Then after incision, we always stitches, fix the abdominal muscle always. And then the result will be, of course, flatter and more sculpted when we repair the muscle.
No,
No.
nothing for
No?
scars.
Okay. No food type to tighten abdominal muscles, nothing like that? Okay. So, of course, we actually decide doing abdominal muscle tightening during the surgery. Before the surgery, during our consultation, we are actually getting an idea if we are going to perform it or not. But especially in gastric sleeve patients, post-gastric sleeve patients, interestingly and ironically, their abdominal muscle tone is quite good. So rarely we skip doing abdominal muscle tightening if the condition of the abdominal muscles are really good. But it is fair to say that maybe 90% of our tummy tuck surgeries, we actually perform abdominal muscle tightening. So, Dr. Hassan Ozan, are you ready for your fifth question?
Yeah.
Okay. Will a breast lift change the size of my breast?
You mean just breast lift, right?
I asked you, so I think just the breast lift. But
Yeah.
you can answer for both. I mean, reduction is reduction. It's reducting, so I think it's just breast lift.
Yeah, just breast lift, the operation, after operation, the breast size will not change because we solve the problem, the sagging, and we do the nipple knee position. We use the same tissue. But sometimes if the patient has excess skin, we just remove the excess skin, no any breast tissue. But if the patients want the bigger one, we can use the implant. Or sometimes the patients have the more breast volume. We can also do a reduction with lifting together.
Again, to give a general idea of breast surgeries to our patient is that our patients firstly should decide that do they want to change the size of their breast? Do they want to go smaller? Do they want to preserve their breast volume, or do they want to go bigger? If they want to go smaller, the preferred surgery should be breast reduction surgery. With the breast lift, as Dr. Ozan just mentioned, we basically manipulate and remove the skin. And then we lift the soft tissue up. We provide perkier, rounder, and lifted breast with breast lift surgery. If you want to go bigger, we should inject and add volume inside the breast. And for that, we have two options. We can put implants inside, and then we can do the breast lift, or we can inject fat. We can do fat transfer, and then we can do a breast lift again. If you are aiming for breast augmentation without breast lift, and the only thing to consider here, if you are suitable for the surgery or not, and during our consultation, it's going to be clear. So, Dr. Hassan Ozan, are you ready for your next question? So, what can I do to prepare for a breast lift after gastric sleeve surgery?
Of course, it is essential to maintain a stable weight. This is very important. When the patient's weight loss stops, after 2 months later, we can do this operation. And if the patients use smoking, he should quit this, or other nicotine products. They shouldn't use this because of scars, stitches, for healing the tissue. But as I said before, the most important thing is the stable weight. If they losing weight again, we should wait. Then maybe 2 months later we can do this.
And I have one more thing to add. Before your breast surgery, we should be sure that you do not have any underlying conditions for your breast tissue. No breast cancer, no suspicious lesions or something like that. So before having breast surgery, it is essential and advisable that you get a mammogram or breast ultrasound. So we can perform your surgery with a clear mind. And Dr. Ozan, these were all prepared questions for you. I think now we are going to get our new questions if we have them. Here we are.
We have some questions. Let me ask.
List of the surgery.
Yeah, there's a question of the price lift of the surgery, but yeah. I think they just want to know how much is the surgeries, but
price list of the surgery.
But I think our coordinators are all informing these things.
We have a very beautiful press lift for you, but our coordinators can only help you.
Yeah, just contact CliniCup from Instagram, YouTube, Facebook, or from our website. So one of our coordinators will contact you. So they will all inform about the prices and the procedure for you. Then they will contact with the surgeon if you're suitable or not for the surgery. So can one start driving one after the procedure?
Well, okay.
Right.
So it depends on your surgery, of course. So I think I'm going to list all the surgeries to answer this question. If you are having a breast implant surgery, for example, since we will be putting the implant under your muscle, your pectoralis muscle, you should be avoiding using your arms and your pectoralis muscle for at least 1 month. So we advise those patient group to avoid driving for at least 1 month. For other patient groups like breast reduction, breast lifting, tummy tuck, BBL, liposuction, all other surgeries, you can actually 1 week, 2 weeks after your surgery, you can drive. But we advise our patients not to drive longer than 30 minutes. There are a couple of reasons for that. Number one is your body is still fragile, and while driving, you are actually showing some effort. And to mind your body, to ease your discomfort, it is better not to drive more than 30 minutes. But 1 month after your surgery, you have all the freedom you want. You can drive as much as you want.
Do you want to add something?
Yeah, as Dr. Burak said,
Do not drink and
just breast lift without implant, of course, and the breast reduction, they can drive no more. Because most of our patients has tummy tuck, the BBL, liposuction, arm lift, thigh lift, it's of course risk. We don't recommend.
I also want to add something as a dietitian here. So after the surgery, we are also here for you to, for your surgery success and to not have any swelling, etc. That's why, as you know, the diet is also so important after the operation. You to take enough liquid in your body. Also, we can add some protein supplements or some collagen supplements. You to not have any complication or any missing things in your health. That's why you can also contact us so we can inform you about our nutritional support packages to improve your health. Let me ask the other question. How about acid reflux after gastric sleeve? I think this is for general surgeon, but if you want to answer.
Yeah.
I mean,
Reflex.
if you do not have any underlying condition before the surgery, the abdominoplasty or the tummy tuck surgery itself cannot lead to acid reflux or any gastric problems. But if you do have an underlying problem before the surgery, it might exacerbate it, and it might lead to put a diagnosis about your pre-existing condition. But as I told you, the surgery itself is not a risk factor to cause acid reflux or any other gastric problems. Maybe, and rarely, again, if you have an underlying condition or if you are susceptible to this kind of stomach problems, the stress of the surgery might lead to something, a condition called the stress ulcer. And that is treatable with medication after the surgery. So that's basically everything to know.
I also want to say something. After the gastric sleeve surgery, you might have some acid reflux, but especially for the first month, you will have some stomach protectors, which we will provide at the hospital for you. Also, we will give some dietary recommendations for you for acid reflux as well. But even if you, after that, after 6 months or something, if you still experience this, you can always contact our post-op doctors about like medication or any medical treatments that you can have in your country too. The other question is, can you breastfeed after a breast lift? Breastfeeding.
Just breast lift. I can say all breast surgery about. For breast augmentation, we always use the implant under the muscle we put there, and there is no risk. And the breast lift and breast reduction, there is a maybe 5%. It's very less. we usually try to protect especially the superior and the lateral side. And then just augmentation, there is no risk, and another lift and reduction, it's a less risk.
So just like Dr. Ozan said, for breast augmentation, there is no risk because we are putting the implant under the muscle and we have no business with the milk channels or the breast tissue itself. However, with breast reduction and breast lift surgery, it purely depends on the nature of the breast tissue. Because for every female breast, there is the breast tissue and there is the fat tissue, and it's impossible to know beforehand which tissue is more in your breast. So if you have a fat-rich breast tissue, there is a higher chance for you to breastfeed after the surgery. If your breast tissue, if your breast is rich from the breast tissue itself, naturally we are going to cut and manipulate that soft tissue, and it is unlikely to breastfeed after the surgery. Again, there's a scientific data about that, and the scientific data says that 2/3 of the patients who underwent breast surgeries will be able to breastfeed actually. So that's it here.
All questions are finished, so we have some couple of minutes. Let me add something as a dietitian too. So you know that after bariatric surgery, it's possible to lose more than 30 kg. That's why it's really important you to reach your goal weight, but we also aim you to reach your goal body as well. That's why if you have any saggy skin or if you have anything that you don't like in your body, our plastic surgeons are all here. And as Clinic Up team, we are also here to inform you on the best way. So do you want to add something too? Or is there any other questions that we need to answer?
Yeah, the question was usually about the tummy tuck and breast surgery, but the post-bariatric patients, we always do the arm lift, arm lipo, thigh lift. This is the body contouring, another operation, and we do this. And
That's pretty much everything.
We do everything here.
yeah, we do everything for about the body.
So they're all sending pictures to the surgeons, so you can see before they come, right?
Yeah, of course. We decide to which operation is first. Sometimes we do video call with our patients. We answer their questions.
Perfect.
That's all.
Are there any questions? We have some audiences here as well, so we have like 5 more minutes if you have any other.
Okay.
Do you want to?
Especially after gastric sleeve surgery, it is important to keep that in mind. These surgeries are they are challenging, preoperatively, postoperatively, both for the surgeon and the patient. And it is essential for our patients to be mentally and physically ready for this surgery, because for at least 1 month you will be in a really challenging position and we will be here for you. But it's not an impulse decision and it's not a getaway surgery. You should be committing yourself for several weeks, and again you should prepare yourself to this surgery in order to have the best possible outcome. So I think that's everything.
I think we have answered all the questions, but
Okay.
if you still have some questions, just comment below. You can also contact us from any social media accounts like Instagram, Facebook, YouTube, or website, so we can keep informing you. Thanks for joining us then.
I just want to add something
Sure.
for London. Yeah, next week I will be in London on Friday and Saturday. If the patients want, we can do, of course, consultation face-to-face.
Oh, so Dr. Ozan will be alone in London. I'm not coming, so I hope in October or November. Okay. So
Okay then. So we can say goodbye then to our YouTube Live session until the next one. Have a nice day.
Bye-bye. Bye-bye.
Good evening.